This video is to discuss standard and transmission-based precautions. My name is Anya. Okay, so we'll start with standard precautions, or what is termed as universal precautions. It is the minimum infection control procedures for any and all patients in all situations. The basic precautions you're going to use for a patient. First thing is going to be hand washing. We're going to wash our hands when we go into a room. We're going to wash our hands before we leave. If we have to come into contact with the clients, any type of fluids on our assessment, for instance, we need to place on some gloves. And if it becomes a issue where we need to put on a gown, we should also do that. When standard precautions, when it starts going above and beyond the standard precautions, bodily fluids, bloods, and all these different things, and we go into what we like to call transmission precautions. And one of the first ones is contact. When we come in contact with bodily fluids of any type of known or suspected infection, you are going to put on your gloves. You are going to put on gloves. If there's any case of any splashing to the clothes, you're going to put on a gown. Eyewear is good, especially if it's going to be splashing and you got a patient that's moving around. We also can use disposable stethoscopes depending on the type of infection or where the infection is. The next thing we will go into, we will also, if we're going to put a patient on any type of contact precautions, we will place on the door about contact precautions, so all the healthcare personnel going in will know what to do when they get inside that room. The next one is droplet precautions. droplet precautions is for your respiratory things that are transmitted by sneezing or coughing. Any known suspected, for example, COVID was a droplet precaution infection. If the client is going to be out in the hall, have to transfer for anything, you could place a mask on the client during transfer. Also, you will use them in the room. If you're going to always wash your hands. You're going to do the basic stuff. You will place a mask and a gown on when you go in there in eyewear for the droplet precautions. Also limit the client's movement, and also place the information, the proper signage on the door, so everybody going in. Also, one of the things we can do is also teach our clients cough etiquette, which is covering your mouth so the droplets won't transfer. But we also need to teach our clients to wash their hands as well if they're going to be doing that. The last transmission is airborne. That is your TB, your measles, your chicken pox, a type of herpes, disseminated herpes, I think the proper name for it is. And that's things that are transported through the air. You definitely have to put up signage for it. The healthcare personnel would need to wear like an N95 type mask. They have to be fitted for or something, or more on the higher end of that. Limit the movement. Try not to have healthcare personnel that are susceptible, like pregnant women. Any healthcare personnel like that do not need to go in a room where there's active measles or active chicken pox, any type of TB. They don't need to go in those rooms because they are. They also need to be immunized. I'm having trouble saying my words today. Immunized as soon as possible. Also, we want to limit those clients from, freely visiting all over the facility. They need to have purposeful movements, and they need to have a mask when they do it. Also, these airborne clients should be in a private room to prevent contaminated other clients. with our droplet precautions, we can actually cohort if they have the same infection. But you still would need to wash your hands. You still would need to wear a mask. You still need to put on your gown. You can also cohort the contact people, but you still would need to practice the proper techniques, washing hands between clients. You wash hands between. You would prepare your things for each client. You won't just travel from client to client in any of these precautions. It is not safe. It is not safe, and you risk transmitting what one patient has to the next. I think I have covered everything on that. Thank you so much.